Hello, and welcome to this episode of In Discussion With from PharmacyUpdateOnline. Today, I'm talking to Professor Rob Horne about how an understanding of behavioural science can help to improve consultations with patients. Please, can you start by introducing yourself?
Hello, I'm Rob Horne, a Professor of Behavioural Medicine at University College London School of Pharmacy. And I trained originally as a pharmacist way back in the 1980s, and I practiced for 10 years in clinical pharmacy in various London teaching hospitals and in Brighton, before being supported by a Department of Health pharmacy enterprise scheme to do a PhD in the psychology of medicines and understanding patient perspectives of treatment. And since then, I've been researching that topic, leading a research group at UCL called the Centre for Behavioural Medicine, to look at understanding how we can make pharmacy services and support around medicines more effective by understanding the psychological and behavioural factors which influence the outcome of treatments.
And can you give us a brief overview of your role, what your current job involves?
My role at UCL School of Pharmacy is to lead a research group where we're looking at the psychological and social factors that determine the outcome of treatments. And as a result of that, I also teach on the MPharm degree and postgraduate degrees in pharmacy, medicine, and other topics. And that's the stuff I teach is all around the research that I do, which is about how can we understand behavior as it relates to pharmaceuticals and use that understanding to improve the quality of care and support that we give to patients.
Now, you have written extensively about how psychological and behavioural factors influence the way patients use their treatment. Can you just tell us in a nutshell what this is all about and why we as healthcare professionals should be interested in it?
What's all this about? How does psychology influence treatment outcomes? Well, really, it's in two ways. First of all, by influencing our behavior. To get the best from medicines, they have to be prescribed to best effect. That's one behavior involving a class of humans otherwise known as prescribers. And we have to take them to good effect. And that's the whole issue of how patients engage with treatment and the issue of adherence. So those are the behavioral factors, but there's another set of issues as well where psychology is important, and that's in determining the direct effects of a medicine. Now, we all have come across the placebo effect, which is where you can get a physiological response from a substance that has no pharmacological active ingredient. We can also see a nocebo effect, where you can get side effects from placebo. But the element that we're researching is how these non-specific effects, the psychological aspect of a treatment, are also relevant for active drugs. So our psychology influences how well a pharmacologically active treatment works for us, but also our beliefs influence whether or not we get side effects. And these are some recent findings from our group. So in summary, there are two effects. One is what we do, our behavior, and the other is a direct effect of our psychology on physiological responses and treatment outcomes.
Now, could you talk us through how these approaches might be used in practice to improve the response to treatment?
Okay, so what's the relevance of this for community pharmacy? Well, let's take the first example of patients' behavior. So we know that many patients don't take prescribed treatments, and that's relevant for community pharmacy because a lot of what society needs from community pharmacy is support in helping patients get the best from prescribed medicines, because it's a significant healthcare investment. WHO estimates that a half of medicines prescribed for long-term conditions are not taken as directed. So that's a massive efficiency gap. How can pharmacy help fix that? Well, From our research, we can see that there are two main reasons why people don't take medicines. They can't or they don't want to. It's a lack of ability, but also for many people, a lack of motivation. They don't want to do it. Pharmacy is traditionally very good at helping with limitations in capability. The patient wants to take it, but they can't because of barriers beyond their control. They forget, they haven't understood it, they can't access the medicines. The medicines are too complicated to use. Inhaler technique, for example, they can't afford it. Pharmacy is traditionally very good at helping patients by taking the medicines as simple and as easy as possible. And those things are very valuable. But the thing that's often neglected is the don't want to. And we know from our research that many patients they don't come to the encounter with the pharmacist or the medicine as a blank sheet that we can write the instructions on. They come with pre-existing ideas about the nature of their condition and about pharmaceuticals and whether that medicine is the best thing for them. The problem is those beliefs are often hidden because we don't ask about them, and patients are reluctant to tell us that they have a doubt in the treatment or a concern or that they're not taking it because they think that will offend the healthcare practitioner. So what we've shown is that by having a better understanding of what the patient brings to the encounter with the medicine can be used to explain the medicine in a different way that overcomes doubts about, whether they need it. Do I really need this medicine? I'm feeling better. Do I still need to take it, for example? And concerns about medicine. If I keep taking it, will I get long-term effects? Will I get the side effects that I read about in the leaflet? So once we understand what is in the patient's head, if you like, what they're thinking about the medicine, we can address misplaced concerns or doubts that are based on mistaken understandings of the condition or the treatment.